everyone, it's Nurse Jenn at Newport SMP, and today's topic of the day is, can I cut my hair or change my hairstyle after getting a density treatment? So this is a really great question and it definitely deserves some discussion. So first and foremost, I want to explain. When you do shaved head SMP versus density, the pattern is very different. When we're working on a shaved head, the dots are very specifically spaced apart to really resemble, the surrounding areas where you're not thinning. You want to keep it very consistent so it all looks even, it has a perfect flow. Now, when you're working on a density treatment, this is a completely different technique. And you have to pack the dots in 20 times closer together and even use darker hair colors. I'm gonna flash to a photo that I've actually shown on a previous discussion topic. And now specifically I'd like to show this guy because it's a perfect demonstration. So with this particular client, we did a scar treatment for an FUT scar. He was going in to get an FUE hair transplant after already having had 2 FUTs. The doctor obviously had reutilized the same incision, that's why you only see 1 scar. So with this particular guy, when he came into my clinic initially, his priority was to make sure that when they shaved and exposed the back of his head for his FUE transplant, they were going to need to shave basically the back half of his head, which would expose the FUT scar. They have to do this because they need to have full surface area to collect the donor hair to put into the recipient site. Now that being said, when this gentleman came in to see me, his hair was grown out like the image that you see on one side where you can still visibly see that scar. Now on the other side that's shaved, you can look very closely. It's very hard to distinguish where that scar starts and stops because as I blended in the SMP to be consistent with his natural pattern of hair. Now another thing I want to point out is that his hair is lighter when it's shorter and his hair is much darker when it's grown out, which means that you have to add in a lot more density and a much darker color to get the coverage to make that scar invisible when his hair is grown out. So stay with me, I know it's confusing, but when this guy came to me, because his objective was to be prepared for his FUE transplant, he knew beforehand that his goal after the FUE was to grow his hair back out to his most comfortable length, which is the side you can see is a lot longer. So when he came to me, we made a decision that we would only do 2 treatments out of the 4 because we knew that after the transplant, he is going to grow his hair back out and that scar will become visible again. So now going back, you can see that the scar portion that I worked on with his hair shaved is actually really nice. It's very inconspicuous. But then on the other side, you can see the scar again. So when he finishes his hair transplant, he's gonna come back to me and I'm gonna do 2 more layers and really darken it up to build up that coverage and to darken it to the color level that we need to be consistent with his hair color. His hair is the same color on both sides, whether his hair is shaved or whether his hair is long. But to go to the point, when your hair is longer, it looks much darker and you need to add in 20 times more coverage to get you that final result. So back to the discussion. Can you change your hair length? Yes, you can. After doing a density treatment, you can change it to a certain degree. However, I would never recommend cutting it shorter than a 3. Some people might be able to get away with a 2 if they're not as severe, but overall, the general rule of thumb is don't cut it shorter than a 2.5 or 3. You can grow it as long as you want after that point. You could go 4, 5, 6, you can grow it to the length that my hair is. And it'll look absolutely amazing. You just will never be able to shave your head after. It just wouldn't look good. If you want to get a general concept of what it would look like, it would essentially be like pouring, those hair powders or Topic on your head as is and then shaving your head. It would look really bad. So we just want to be really transparent so that you know what you're getting yourself into. Now bear in mind, SMP is not a truly permanent procedure. This is a semi-permanent procedure. So you're gonna need to touch it up every few years if you wanna maintain your results. If you don't touch it up at all over the course of about 10 to 15 years, most people will feel like it disappears almost completely. Now the good news is that all the pigments that we use are created on a gray scale. So they're not going to turn green and blue. They're going to fade into what looks like a 5 o'clock shadow. So it will be no harm, no foul. And honestly, I do think it's actually a positive that it's not completely permanent, because you don't know what you're going to be willing to go through as you age. You do this when you're, in your 20s, 30s, 40s, 50s, you still have so much time left. And so you don't know what you're going to be willing to do as far as your maintenance when you're 80 years old. So it's just good to know that you're not, really committing for something lifelong. So I hope that was helpful. If you have more questions, please reach out to our office, or better yet, set up your free consultation. Our phone number is 949-520-2525.